From whether bikini waxes are hazardous to your health to a new pill that promises to cure hangovers, we are asking the doctors all about the medical hot topics in the headlines. Please welcome OBGYN Dr. Jennifer Ashton, internist Dr. Stephen Lamb, and dermatologist Dr. Doris Day. Welcome, everyone. Okay, so we have a lot to cover. Dr. Day, I want to start with you. A medical hot topic right now, Brazilian waxes causing infection. Is that true? And what's the alternative?
Yeah, we see lots of infections after things like waxing and also ingrown hair. So you can have staph infections, herpetic infections if you're prone to them, or even from being transmitted.
From the actual waxing or after the waxing?
If the place isn't clean. So one is if you're prone to it, it can happen just because it happens from the heat and the trauma. But sometimes if the place isn't so sterile or clean, if they don't have great technique, that can be a problem. But if you get rid of the follicle, you get rid of the problem and you never have to shave again. And plus, who wants to wait for the hair to grow that long to wax it off? So I have a model. We have Taylor, and we're going to show you on the arm. So this is a new laser called the Light Shear Duet, and it helps to remove the hair. So it's a large spot size. I won't turn it on while I'm pointing at anybody. And it covers a whole area, and in one fell swoop, just by pressing,
and you can see the hair to have this done?
Yeah.
Does that hurt?
No, it doesn't hurt.
It doesn't hurt.
You can see it sucking it up.
Are there any side effects to this thing?
You can do this in the bikini area too?
You can do this in the bikini. Covers the whole bikini area, thank you, Taylor, in just 5 minutes, literally. It's virtually painless, no gel, and it's
bring back pubic hair. Just bring it back. We don't need this baldness anymore.
Right, but even if you just wanted to clean up the sides a little bit, so you can wear a bathing suit and not be too embarrassing, so it's a great alternative.
Everyone can choose to trim their tree how they like.
You can use it on your eyebrow.
Dr. Lamb, one of the biggest health stories last week was that the FDA approved an over-the-counter tablet that promises to cure hangovers. Is this really possible?
Well, you can certainly reduce the symptoms. 75% of people who drink excessively are going to feel a headache, nausea, weakness, stomach aches. They're going to feel terrible, okay? Because we metabolize alcohol to a substance which is called acetaldehyde, which is toxic, okay? What you need to do is you need to drink less, obviously, but while you're drinking, you want to rehydrate. You want to take in some fluids that have thiamine and B vitamins. And stuff that will help your liver. The following day, if you want to take some aspirin and caffeine, which is really what blowfish is, of course you're going to feel a little bit better.
So
but it's really due to the fact.
Why not take it before you start drinking?
I think it's actually a great idea to take it at night. The problem is that both aspirin products or acetaminophen can affect the stomach or the liver, so you got to be a little careful.
And affect how the alcohol
I'd rather that you rehydrate yourself.
When you say too much drinking, what do you mean?
More than 4 or 5 drinks. And women are going to be much more sensitive to this than men.
All right.
And one quick tip is that a lot of times when you're a little hungover the next morning, it can show on your face and around your eyes. So if you make a pot of black tea, you let the tea bags cool to room temperature and put that over your face, the caffeine and the antioxidants can depuff and help those dark circles pretty quickly. So it doesn't have to show when you go to work.
That would help. Dr. Ashton, just a few weeks ago, we talked about TLC reality star Michelle Duggar. She was pregnant with her 20th child. We were sad to hear that she had a miscarriage. Is there more risk associated with the birth of a 20th child than a 4th or a 1st?
The short answer is yes, and whether it's your 20th child, your 20th pregnancy, or your 1st, miscarriage is heartbreaking. It occurs in 1 out of every 6 pregnancies, so if a woman is pregnant enough, she will suffer a miscarriage, but she is high risk because she has had so many babies and because of her age. But on the good side, I think she's really pretty inspiring. I mean, to have the mental and physical strength to raise 19 children, I have a hard enough time with 2.
But is the human body really, ready to have?
Joy, I think that we're seeing incredible things from women in their 40s today, i.e. Dara Torres training for another Olympics in her mid-40s. So it's really on an individual basis.
She also suffered from preeclampsia, so did that complicate it further, obviously? And then does it make it dangerous for her to get pregnant again?
It makes her more high risk in subsequent pregnancies.
And certainly don't drink while you're pregnant.
How do you think you get pregnant in the first place?
Before is a different thing, Joy.
Because drinking actually affects the memory center, and you don't even remember what you're doing.
That's right. Dr. Day, I want to start round 2. Okay, it seems women are getting younger and younger when they're starting the anti-surgery but stay young forever treatments. When is it too young? And then what if you start and then you stop? Is there some sort of rebound from like Botox or anything like that?
So we really encourage women to start their anti-aging as early as possible. I really say it starts at birth, but it means different things at different ages. So at birth, it's really about sun protection, proper diet, getting enough sleep. And in your 20s, it's really still about those same things, but women in in their 20s want to start adding some new treatments in. So my goal is to encourage them to be minimalist in how they do things, help treat the acne scarring, the discoloration, and early signs of sun damage, not move to those greater procedures where they look like they've had something done. And you can see from before and afters, this is the Clear and Brilliant. The same people who make Fraxel made this device, and this is a good kind of a starter device to help give you clearer skin, smoother texture, helps treat those brown spots, which are really starting to bother women even at younger and younger years. And along with it, they'll do sun protection and proper skin care, add a retinol, which is even available over the counter, and they'll maintain that beautiful, healthy skin without doing the bigger procedures.
The brown spots are like freckles, sort of, right?
They're freckles or they're sunspots and from sun damage, so they do accumulate.
After you remove those things, you get scabbing, right?
You can, but with this device, it's minimal. So even for people who just want procedures but don't want the downtime, this is a nice, gentle thing to start with.
Okay.
And it's great for off-body, too. So women who have more sun damage can treat their chest, their hands, their arms, their legs for all those sunspots.
Yeah. Dr. Lamb, you know, we always hear the saying, you're suffering from a broken heart, but you're saying it's actually a medical condition.
No, actually, you know, for people who suffer these terrible losses, especially with anger, you can actually cause an acute damage to your heart that is very similar to having a heart attack. You can actually die from this. The good news is that it's generally reversible over a week, but you actually present to the doctor with severe chest pain, shortness of breath, and you don't even know that you're not having a heart attack. But what happens is a part of the heart just becomes non-compliant, just expands, and it's due to the fact that you release a lot of stress hormones that actually injure the heart. And this is really called the broken heart syndrome.
And more common in women.
In women 50 and older.
And go ahead, ask her.
No, I just want, this is a jumping topic, but Dr. Action, you said something interesting to me earlier. More and more college-age students are coming into your office.
Yeah.
Why is
this
that?
is actually the busiest time of the year for college-age patients to come back in. They're studying hard at school, but they're also engaging in some other extracurriculars, so they are very diligent about getting screened for STDs. Teens need to see a gynecologist for the first time between ages 13 and 15.
13 and 15, girls especially.
Wow.
Right. Well,
busy time of year.
That's right.
All right, thanks to Dr. Lamb, Dr. Day, and Dr. Ashton. You can catch Dr. Jennifer Ashton on the new ABC daytime show, The Revolution, which premieres January 16th. We'll be right back.
We wish you happy Hanukkah, and everybody have a great day. Enjoy the view.